Okay, today we are going to start our topic, that is drug used in the gastrointestinal disorders. The gastrointestinal disorders include the peptic ulcer disease, the motility promoters, the inflammatory bowel disease, irritable bowel syndrome, and other agents, and then there is antiemetics. Including in the peptic ulcer disease, there are the 5 group of drugs. First of all, there is antacids. Antacids include magnesium hydroxide, then is calcium carbonate, aluminum hydroxide, then is sodium carbonate. Then we have H2 receptor blockers, that is cimetidine. All drugs which include tidine is H2 receptor blockers, histamine blockers. Then we have proton pump inhibitors, which includes omeprazole, esomeprazole, lansoprazole. Then we have mucosal protective agents, which include sucralfate, bismuth sulfate compounds, misoprostol, or then we have antibiotics. These 5 group of drugs we give in acid peptic disease. The next disorder is motility promoters. Motility promoters are the prokinetic agents, which include metoclopramide, cholinomimetic drugs, and domperidone. Metoclopramide, cholinomimetic drugs, domperidone, metoclopramide, neostigmine, and bethanicol. Neostigmine, bethanicol, metoclopramide, cholinomimetics, domperidone. Then we have drugs used for the irritable bowel syndrome. Irritable bowels, for the its mnemonic is SAC. SAC include the serotonin antagonist alosetron for irritable bowel syndrome. Alosetron, serotonin antagonist, anticholinergics, A for anticholinergics, and chloride channel activators. Then we have drugs for the inflammatory bowel disease, IBD. Includes the CIA is the mnemonic, C for corticosteroids, I for immunosuppressive agents, and A for 5-amino-salicylic acid drugs, and A for anti-TNF drugs. And 5 acid drugs include mesalamine, and other agents include the pancreatic lipase, laxatives, antidiarrheal drugs, ursodiol. Antiemetics includes the 7 group of drugs. The mnemonic is HH Canada. HH includes 5-HT3 receptor blockers, which include ondansetron, granisetron, dolasetron, palansatron. 5-HT3 receptor blockers, ondansetron, which is usually named as onset, ondansetron, granisetron, dolasetron, palansatron. The second is D2 receptor blockers, which is prochlorperazine, metoclopramide. D2 receptor blockers, which are the dopamine receptor blockers, prochlorperazine. First H for H2, 5-HT3 receptor blockers, serotonin receptor blockers. Second H for H1 receptor blockers, diphenhydramine and phenothiazines. And then C for cannabinoids, dronabinol, nabilon. Corticosteroids, dexamethasone is also antiemetic. Cannabinoids, cannabis, nabilon, these are also antiemetics. A for antimuscarinics, that is scopolamine, phenothiazine, scopolamine, these are antimuscarinics. Then N for neurokinin receptor antagonists, that are pitants, apripitants, neuropitants, rolapitant. Pitants is the mnemonic. Pitants is the word which ends with these drugs. Neuropitant, rolapitant, apripitant. Neurokinin receptor antagonist. The second is silent, and the D2 receptor blockers. D2 receptor blockers includes prochlorperazine. Okay. We have 7 group of drugs. 5-HT3 receptor blockers, which include ondansetron, granisetron, palansatron, dolasetron. Then other is H1 receptor blockers, that is diphenhydramine. Then we have corticosteroids, dexamethasone. Then we have cannabinoids, that includes cannabis and nabilon, donabinol. And we have A for antimuscarinics, include scopolamine, phenothiazines, neurokinin receptor antagonist, apripitant, neuropitant, rolapitant. And then we have D2 receptor blockers, which is prochlorperazine. These are the antiemetic drugs.